So in the maternity medications, first most important which we need to discuss is about the magnesium sulfate. Now, in the magnesium sulfate, what do we need to know? The magnesium sulfate, basically, it has two major functions because it's a relaxant, so it causes a smooth muscle relaxation. And the second thing is it's a CNS depressant. And because of that reason, we can give this medication in maternity to preeclampsia or eclampsia patients as a part of anti-seizure medication, right? Because we just want to control the seizures into them. So majorly it has two main functions. So overall, I would say magnesium sulfate is such a medication which makes basically relax and calm down the body, right? So that is why we are choosing this medication for two purposes, either as a CNS depressant or either as a smooth muscle relaxation, right? Now, when we say that they are CNS depressant, can we use it for something else in maternity? The answer is yes. We can use it in the mothers who come in the preterm labor with the contractions. And if the doctor feels like this is not the right time to proceed with this thing, we can stop the preterm contractions, the preterm labor, by giving this medication, magnesium sulfate. So that means this medication is important for two major purposes. Again, we are only talking about in terms of maternity with the magnesium sulfate, because magnesium sulfate, you can also use it for another different clients too, outside maternity. But in maternity, if I'm talking about today only specific, this is only for two main reasons. Number one, to stop the preterm labor, as I mentioned earlier. And the number two is to control the seizures, right? Now, once we know the purpose and everything, let's talk about what this medication can does inside the body. Is there any side effects or adverse effects? Yes, we do have some side effects and adverse effects. The most common, I would say, not the adverse effect. Sorry for not adding side effect heading in here. You can add up later if you like it. But the most common side effect for this medication, I would say, is the respiratory depression. Remember, this is not the adverse effect. This is expected side effect with this medication. No doubt it's on the danger side, but still this is expected with this medication. And that is why before you administer this medication, you need to make sure you check the respiration of the client always. And if it's 12 or less than 12, you cannot give this medication to the client. Now, apart from the respiratory depression, does this medication has any other side effects, adverse effects? I would say the side effects common will be like just nausea, vomiting, that can be there. But if the client has not just nausea, vomiting, they have multiple symptoms at the same time, then that is no more side effect. That is sounds like adverse effect now, which could be signs of magnesium toxicity, right? So feeling like lethargic, facial flushing, diarrhea, nausea, vomiting, weakness, any of these symptoms at the same time together, multiple symptoms, that could indicate a sign of the magnesium toxicity. And that is why we always check magnesium levels with these clients as a nursing intervention, because you want to make sure your client is not having the toxicity symptom while they're on the magnesium sulfate. Now, apart from this one definitely I would say the adverse effect for sure, because the high doses can lead the loss of deep tendon reflexes, even the heart block, respiratory paralysis, even the cardiac arrest. So basically everything down, down, down inside the body if you see all these symptoms. So this is what we call the adverse effect, because they're really bad or badly on the dangerous side if it's affected. And this can happen with the high doses. Again, it's a toxicity symptom, one step ahead, and that is something can be happen with this medication. So that was about side effects common and adverse effects at the same time, the mixture of them together. Now, once you know what they can do, let's talk about where you're not going to give this medication and it's not recommended. Well, if definitely the heart is already down or maybe the kidneys are down, you're not going to give this medication, because if this is like a depressant kind of medication, if your patient is already had a heart blockage or conditions like myocardial infarction, you actually put the patient more down when you give these pills. So better not to administer this medication when the patient already have existing conditions like heart block or the myocardial damage. Even the kidneys are not functioning, you're not going to give this medication, because if the kidneys are not functioning, that means they're not excreting the extra enough. Now, that means the patient will be having more toxicity inside of this medication. So always make sure your patient kidneys are functioning good while you're giving these type of medications. Now, that was pretty simple thing, what this medication does inside the body. Let's talk about what do you do as a nurse in here, as an RN, if your patient is on magnesium sulfate. First of all, if ever you notice any adverse effect, please discontinue this medication right away, okay? Because you don't want the effects to be happen as a continuing decline. You really want to stop this medication and notify the doctor. But I would say before notify the doctor, if NCLEX is giving you another option, assess your patient for another symptoms or check the oxygen level, go for that first, because you always want to do the assessment first before you call the doctor quickly, right? And as I mentioned earlier, always check for respirations. If ever you find them less than 12, don't administer this medication. Discontinue right away if it's still running. And also, if you notice kidneys are not functioning enough, for example, you notice less than 100 ml urine in 4 hours, no good, right? Because the normal urine output is 30 ml per hour, right? So it should be more in 4 hours. Why is it only less than 100 in here? That means kidneys is not functioning good. And always checking the deep tendon reflexes, because if you know if the loss of deep tendon reflexes is started, that could be a sign of the toxicity back again. And always do your magnesium levels ongoing assessments with the lab work. You blood draw and check everything in there. And even if you find it out, it's pretty high side. So for example, if it's more than 7.5 or more than 3.75 in millimoles, that means the patient is getting the toxicity. And in your NCLEX exam, you always get the normal values next to them. So if ever you're having the value, for example, they tell you 8.2, they will tell you normal value in front of it is 4 to 7.5. So this way you already have an idea it's high, right? Once it's high, as I already mentioned, discontinue, assess your patient, and notify the doctor right away. Now, remember the antidote is calcium gluconate for this medication if ever you need it. So always have it, make it accessible at the bedside, please. If in case you need it, you can administer it. This is the same thing what we already just discussed, that always monitor your client receiving magnesium sulfate very closely for the signs of toxicity, and always call the doctor if respirations are less than 12, because as I said, that is indicate respiratory depression or even any other adverse effects is happening, not just depression, you still have to call the doctor. That is all about magnesium sulfate, a very tiny little medication. You can always stop me in between if there is any doubt, any specific question for me. Okay, moving on to the next one, opioid analgesics. Now, again, this medication we can give anywhere, but why are we giving to a maternal mother, right? We are giving to her because she's in pain of labor, right? And when she has a moderate pain, severe pain, she can have another option for pain medication is the opioid analgesics, right? Now, this medication also have some side effects and adverse effects also at the same time. So respiratory depression, it's another one, I would say, an expected side effect. Similarly, just we studied in magnesium, as is similarly side effects with this medication too. So same thing, you're gonna check the respiration for this client always. If it's less than 12, you're not gonna give this medication. You're gonna hold it and call the doctor. Apart from this, same thing, nausea, vomiting, side effects can be happen, sedation side effect, low blood pressure side effect. But if your patient is having a diaphoresis kind of symptom or a flushing phase or the urinary is not there, it's like a more retention in the kidney, so less urine output, that is something no good. That indicate maybe the patient is having the adverse effect symptom in here, and definitely hold a med and call the doctor, right? Now, we already checked in the nursing intervention in the first section that we have to check the breaths always, but besides the breaths, you always check the vital signs of the client with the ongoing assessment, right? Why is it important? Because you want to check the pulse at the same time, and you want to check the blood pressure at the same time as well. Now, if ever you notice the fetal heart rate also getting bad or the contractions is getting bad, I would recommend to hold this medication right away, because this medication can reduce the fetal heart rate pretty easily and reduce the motor contractions at the same time. Maybe toxicity symptom happen with the reduce of contraction, maybe the fetal heart rate can also go down at the same time. So make sure you always stay with your patient when your patient is on this medication. You don't want to leave it in, because your heart rate, patient heart rate, the fetal heart rate, sorry, can also go down at some point. And we want to make sure we're not doing that. We want to take care of the fetus at the same time. Now, besides this, I already mentioned keep checking for blood pressure at the same time, because hypotension can be expected. And if something happened, make sure you do some good positionings. And always keep checking the level of pain at the same time. Keep checking bladder for distension at the same time, because this is like your ongoing nursing assessment to make sure patient is okay. And the antidote is naloxone, which you always want to make it available at the bedside at the same time. If it's needed, you can give it in case of the emergency. In the last section, what they're talking about is if somebody having opioid dependency, we need to make sure we know about that person a little bit ahead of time from history. Why is it so? Because they're going to ask you medication more, because they are already dependent before. That means the dose what you're giving right now to them in the labor, that might not be very effective, right? So due to that reason, they might have some withdrawal symptoms, not just in themselves as a client, but also in the newborn that can be affected. So we need to make sure we know about these things ahead of time and contact with the physician and see if the patient really needs this opioid order or alternative medication if not an opioid, right? If yes, an opioid, then how much dosage will be a good idea for the client to give it in case of labor, because you also want to take care of the newborn at the same time. And that is about the opioid analgesic. And again, if any question, any doubts until here, feel free to stop me in. Moving on to the number 3 medication today, which is the most famous in the NCLEX. Why? Because this is only for maternity, right? So Oxytocin, that is very famous medication. I would say usually every other day tested in the NCLEX. Now, Oxytocin, what it does actually, it has a function of stimulation, stimulate something, right? But what it does stimulate the smooth muscles again. Oops, sorry, I go to the other slide by mistake. It does stimulate the smooth muscles of the uterus and also stimulate the contractions. So that means if any mother, she's already in her term or post-term, or maybe even preterm, the doctor decided to take the baby out for some reason. They want to do induction of the labor, right? And they have a time, they can wait for the labor contractions, right? They will give oxytocin to the mom because they want the mother to have contractions at that point. So that is the first purpose of this medication. Second purpose, it also does the milk letdown. So promoting the milk letdown, that is also another function of the oxytocin. So that means once you know what it does, that means we can easily say, as I said, it does help in the induction of the labor. But as I said, they start contractions. inside the uterine contraction. So that means you can also give this medication to control the bleeding in postpartum mother. Why? Because when the postpartum bleeding is happening, there is no tone inside the muscles. It will be atonic, and you want the muscle to start contracting, because when the contraction will start, the bleeding can be stopped, right? And to help in contraction, this is one of the best medication you want to give it in case of the postpartum hemorrhage as well. Yes, that's correct. And that means we can give this medication also if there is an incomplete abortion happen by someone. We can also give this medication at that time, because you don't want the mother to be bleed inside the body, right? Now that was about the brief information, what it does and where you want to give this pill. Let's talk about some side effects or adverse effects. It does not really have any side effects, so we're only going to talk about the adverse effect in here. Usually it's always have adverse effect, because this is a medication with a faster onset, and it can really lead to adverse effects a lot quickly. So let's see that. Any allergies, dysrhythmia, changes in blood pressure suddenly, or uterine rupture can happen, water intoxication can be happen. All these things happen, can be multiple at the same time, or it could be individually. That still indicates the adverse effects in someone. Now here's an interesting fact. They said even if it can stop the postpartum bleeding, remember it can also lead the postpartum bleeding, actually. Postpartum hemorrhage, I mean. Why it does that? Because only in those cases, if you stop this medication suddenly in someone, right, rather than you're gonna wean it off slowly, you stop it suddenly. Because when you stop it suddenly, the muscles inside the uterus, they can become atonic as well, and that time the bleeding can be initiated back again. So that means we need to be very careful when you're giving this medication. Try not to stop it abruptly, right? Tell the doctor, try your best to wean out slowly, because when they're weaning out slowly with the dosages, then the less chances for the bleeding after, right? So that means this medication, even if they can help in postpartum hemorrhage, they can also lead the postpartum hemorrhage as a part of the adverse effects. I hope it doesn't really sound confusing, but I'm always open to repeat it back again. If any doubts, anything so far, please let me know. And contraindications, if I talk about in the meantime, the contraindications means you don't want to give this pill. Definitely, if somebody have a no plan for vaginal delivery, why you want to give this pill, you know? So don't give this medication in there. If somebody already have a contractions, a lot, hypertonic uterine contraction, don't give this pill, because you don't want to initiate more contractions in there. Now, nursing interventions, damn important. Just so you know, on the left side of the screen, even the right side of the screen, I'll talk about it later. It's a nursing action when there's already too much contraction while the patient is on infusion. What do you do as a nurse at that time? Both questions are damn important, so we're not going to miss it. Now, the first thing we're going to talk about is intervention. On the left side of the screen, they said, always stay around with the mom. Keep checking the mother vital signs, even the fetal vital signs, every 15 minutes. Very important, right? Because as I said, the oxytocin onset is really fast, and it can affect the mother and fetal heart rate quickly, right? So we need to make sure we stay around in there. Do not leave your patient actually here, right? Now, apart from this, you really want to check the contractions continuously, or at least every 15 minutes, right? Because the contraction can be faster at any point. We don't know when. So keep checking frequency, duration, and force of contractions always. Even at the resting uterine, you still have to check the tone, right? So these are the most important when we stay with the mom and we start infusion. And how do you start infusion? You start the infusion by the using of infusion device, okay? Never give this infusion back directly. Always use a device, because you don't want the mother to get a lot of dosages or something. It's a very tricky medication, so we want to make sure we get a specific dosages for her. And in case of an emergency, you always have another solution ready at the same time, which is normal saline could be. Okay, so that is something another important, because if something happened, you want to flush the line right away with the normal saline. Normal saline is recommended, but you can have Ringolector or other solutions as well. But I would say normal saline, the isotonic solution, 0.9%, that is what is recommended the most, right? Now, while you're staying there, infusion is still running. Make sure, as I said, don't leave your patient unattended. You closely monitor the mom and the baby all the time. See if mom needs the oxygen or not. If she does, give her oxygen too. Now, regarding the point number 7 and 8, I'm going to talk about in this section in detail, because that's exactly saying what it says in there. So they said, whenever the mother already on oxytocin infusion, and we already know it's a lot of hypertonic contractions now in there, you know, what are we supposed to do? Because now, if you don't take any action, your fetus can go into decelerations as well, remember. So that's why we need to take a quick action at that time. So first thing I would say is stop the infusion quickly. Stop the infusion and turn the patient on the one side, preferably left side always, right? And call somebody for help right away, because this is an emergency. At the same time, you keep checking if you can give the IV, the other one, the normal saline, right? You want to make that line now, flush it out quickly and stop. You already stopped oxytocin, but you want to start the normal saline line at the same time. So always have the normal saline ready at the side, at the same time the bag hanging. So you don't have time to make another, you know, baggaging and everything at the same time. So always have the 2 bags ready at the same time. One oxytocin, one is normal at the side. And you can only give oxygen if it's needed, and keep checking the vital signs, heart rate, everything, but after you take all the emergency action quickly, right? And definitely ongoing documentation is damn important. So always keep doing your documentation, even during the at the time of the while the team is arrived and they're looking after the mom and the fetal heart rate, because you never know if it's already too much deceleration has been started. Maybe at this point we need to plan the mother to go for, I would say C-section is preferable, because you don't have the time for the mom to push and get the baby out, right? So this is most likely going to happen if the emergency going to be initiated, right? So that was about for point number 7 and 8, which I discussed on the other side of the screen already. And apart from that, they said keep checking the signs of water intoxication, like your reverse effects. Always have emergency equipments available at the bedside. And as I said, keep documenting everything. When you start this medication, when you stop this medication, when you increase this medication, everything, and how the patient responding at the same time. And that is all about the presentation today on maternity section, medications. Is there any other doubts, any question for me? And